All right, good morning, everyone. It's about 6:30 in the morning. I have my ACL surgery set for 9 a.m. this morning, so I'm just waiting for my parents to arrive. I just woke up, so I just packed my overnight bag. I'm waiting for my sorry if I sound groggy and my eyes are bloodshot. My hair's a mess because, like I said, I just woke up. We have about a 2-hour drive to the Mayo Clinic up in North Scottsdale, and then the surgery's at 9 o'clock, and they said they'll start doing the surgery about 11 a.m. and then they said it could be about a 3-hour surgery total. So anyways, but I'm excited, a little nervous, and I will update this after the surgery. So I think I'm going to spend the night, and I know I'm going to probably spend the night there, at least one night is what they said. And I feel like I just did this with you guys a year ago when I had my nose job, when I had like a deviated septum, and I kind of went through all the aftercare side effects of what it's like to have a deviated septum surgery, and what is so painful and gross and annoying about getting one of those, which was like all the gauze that was shoved up my nose. So here we are again. I'll give you guys an update and let you guys see what it's like to have a ACL surgery. So this will be my right knee ACL repair. They're going to use my own muscle or tendons or something. They're going to build me a new ACL using my own body parts, basically. And then it will be, I think, a meniscus cleanup or repair as well on my right knee. So all this is happening on my right knee this morning. And then maybe in a few months, they'll do my left knee. Like not even a month, probably like more like a year. They'll do my left knee. And because that one also had a meniscus tear, or meniscus, it needs to be like a meniscus cleanup. And I think they said it's a partial ACL tear on my left knee. That one's the more painful one, my left one, but I can still support myself and stand and walk with it. But my right one is a full tear, so I can't walk with it basically. So that one needs to be done first because of the accident that I had up in Washington. Anyways, so that's the update for now. I will see you guys in just a few seconds on here when I'm in recovery at the hospital. So let me finish getting dressed and go meet my parents out in the parking lot not parking lot, but out in the driveway. And hopefully everything goes smoothly, so everything goes well. Bye. And just so y'all can see what I'm working with already, but I did shave my leg already. And I'm just being, don't mind all the shoes. I just, this is a temporary place I'm living for just a month, and I'll put all my shoes up on my shoe wall. But yeah, so this is the before. But yeah, like I said, I've already shaved my leg in preparation. Just trying to be nice, I don't want a super hairy leg. Before I didn't shave all the way, but like there's still hair up here. But I figured in the zone that he's going to be working with, I tried to give him a less hairy leg. All right, they're here to pick me up. Time to go. All right, so it's the day after, or not day after, what am I saying? It is now after surgery, and it's been about 3 days. Surgery was on Tuesday. It is now Friday. I'm at least in good spirits, when I am awake, because the pain meds are amazing. They will knock you out for about 4 hours at a time. And so sorry for those of you who have messaged me, text me, trying to get a hold of me, and I haven't responded because I've been asleep, and the pain meds will knock you out. When you do wake up, you're ready for more pain meds because you're in pain and you want more. So it'll knock you back out again. So about every 4 to 5 hours, I wake up, take more pain meds, eat, and then I go back to sleep. So I've pretty much been bedridden for the last 4 or 5 days, for the last 3 days. And I'm thinking 4 or 5 hours. But anyways, so I'll show you guys kind of what it looks like on my leg now. It's nothing grotesque, and it's that'll be my next video. So when I actually get to see the stitches and the surgery wounds and the incision and all that stuff, I'll do another video for that because I feel like that would be a lot more interesting and fun to look at. But for what I have right now, it's kind of boring. It's just the bandaging, the brace, and kind of the aftercare stuff that they wrap you all up into. So um, just so you know, the surgery did take about 2 hours. I went in at about 9 a.m. to do all the pre-op stuff, where they basically shave you down and they clean you up and get you all ready, get you with an IV. They put the EKG machine or the EKG on you. They start. They actually did because I'm on Wegovy, the weight loss injections. They actually did a ultrasound to see and make sure there still wasn't food in my stomach, because Wegovy slows you down so much for food to help you stay fuller longer. That was a concern during surgery. Now that when people go into surgery and they're on Wegovy, how is that going to impact the surgery? Does it make the food try to come back up, or does it impact the just the range of things that it could impact? So they kind of wanted to go through that. I gave them permission to do that. They were asking me if they're okay with me doing an ultrasound to kind of, do like a research study at the time. I told them that was fine. So I didn't take my Wegovy a week prior. I hadn't done a Wegovy shot a week before the surgery. I was scheduled to do another Wegovy shot the day of, and they told me to skip it because they did not want me to slow down my digestive system anymore. They want it to just be as normal as possible to help take food down as quickly as it can, so you're not still stuck with food when you're knocked out. So anyways, surgery took 2 hours. So I went in, like I said, 9 o'clock. By 11 o'clock, the surgery started. And then I was in recovery by 2:30. The nerve blocker that they gave me right before the surgery, right before the anesthesia, because they actually want you awake when they give you the nerve blocker to basically numb your entire leg, that did not work. I didn't know it didn't work. I just thought maybe it was slow acting, or that it would pick or kick in maybe when I was out. But as soon as I woke up from surgery and I was laying there in the recovery room, I could feel the pain and everything in my leg. So it was painful. So the surgeon recommended originally for me to drive home the same day, because the nerve blocker would be in effect and it would be a lot less painful for me to drive home than for me to spend the night, which was the original plan, for me to spend one night in the hospital. So we went with that idea of let's drive home right after surgery, which we did. It was so painful. I was crying in the back of the SUV the whole drive home. It was so uncomfortable. So I don't think the nerve blocker ever worked or ever was in effect. So there's that. Otherwise, the surgery went very smooth. It was, from what I was told, it was a success. It went well. It was much quicker than, they thought it could take 2.5 to 3 hours. I think they said total was just the 2 hours. So to me, that must mean that things went really well, because it was quicker than they expected. Let me pan down. I'll show you guys kind of what I'm working with right now. So yeah, 1 second. All right, so I have 4 brackets or snaps basically in a brace that hold my leg straight as possible. I do have this this ice packet here that has 2 tubes down here at the end that will connect to an ice chest that will bring in more ice cold water to help freeze and numb my leg as needed. But I do have some functionality, so I can still move my foot or my ankle. I can move my leg up and down, but it's sore and it hurts. And they do want me up and moving as much as possible already right after surgery. But I can tell you, it is painful. And I try to do it a couple times a day, but they want me doing it like every couple hours. About every couple hours, which I haven't been doing that. But even when I do get up, I pretty much put all my weight on my left leg and use this walker. So I'm pretty much hopping around. So I just at least get the blood flowing and moving to my leg as I stand up. So anyways, so that's kind of what my leg looks like right now. Like I said, I'll do another video in a week once I get the brace off. And but yeah, I'm pretty much been bedridden. My mom's been taking care of me for everything, food, medicine, changing my bedding, like just anything and everything. You need a helper, especially to just function and help you survive if you have this kind of surgery. So I highly recommend somebody who is able to stay with you if you end up getting an ACL surgery, because you will definitely need somebody to help you with everything. So shout out to moms and shout out to my mom for helping me with everything, and my dad. They've both been here and support and help getting me my medications and going to the pharmacies and whatever. Like, it's just, they've been a huge help. So I wouldn't have been able to do all this by myself with just one leg and not being able to drive around and get all this done. So anyways, that's the only update I have for you guys. I will send you guys another update or another video in about a week once I get this removed, and I'll keep you guys updated. Bye.